I don't know what the biggest obstacle is to getting people vaccinated. I think some of it is fear and misinformation that preys on that fear. But I also think that we just haven't explained to people exactly how vaccines work. I think there's a real mystery there. I mean, one caller, what if we find out in 5 years what it does to us? That's not. We've had vaccines essentially in some form for a couple hundred years, and the idea that ginning up our immune system to fight things by giving it a small sample. We saw that back when people were working around cows that had cowpox back in the smallpox worries. So, I mean, there's some positive stuff in here, but the hardest part again is getting past misinformation, and it really must frustrate the real smart people out there, like our next guest, Dr. Fahmi Farah, is with us. She's an MD and a cardiologist, and joins us here on KGO. Doc, thanks for being here. First of all, I hope you're well, and have you had any firsthand experience with COVID?
Yes, I did, actually. First of all, thank you so much for having me on your show. Throughout the pandemic, over the course of the last year and a half almost, we've seen quite a few COVID cases. Especially during the peak of it, we had our hospitals completely packed, even in the clinic. One of the things we've been experiencing with COVID is a lot of COVID patients, even the ones who had mild cases, are having heart disease, heart problems. So me being a cardiologist, my clinic has quite a few patients who are affected by that and, had heart problems. And so we've been seeing quite a few of those patients.
That's interesting because remember, and this, obviously in the beginning, we thought it was something about the lungs, and it turned out to be more blood than even though it was airborne, it got into our bloodstream. And it was, since the very beginning, from when, Dr. Fauci mentioned, we don't need masks right now. And he wanted to save N95 masks for, frontline workers. We've kind of found, some similarities to the pandemic of 1918. And one of those was Philadelphia and St. Louis. Philadelphia had all the crowds, for the 4th of July parade. St. Louis, a few weeks later, when they were supposed to have a parade, they shut the city down, and they saw a remarkably lower number of infected people. It is interesting to see how incredible science has been and the miracle that mRNA has been. But some of the social distancing and mask stuff's been around for 1,000 years, right?
That's correct.
Yeah.
It's very simple measures.
It's ironic as hell. That we tell people this, and today people are pushing back on masks, and I don't understand it. It's not that difficult to wear a mask when you're inside and, protect yourself and others, especially if it's an N95. You can do both. And that's kind of what they're saying now. The phone number is 808810, and I know that I guess the question I want to ask you is a real basic one. The Delta, when we saw this in India, we underestimated kind of, didn't we? And then when it got here, we saw just exactly how transmissible it could be.
That's correct. We also what happened in India and how quickly it overtook the entire country. To give you a perspective on the Delta virus variant, it's highly contagious in comparison to what we've seen previously. People who are getting infected with the Delta variant, they have as much as 1,000 times more viral load in their nasal area compared to the previous ones that we've seen. So it's that much more potent, so to speak. Also, the infection that it's causing in the lung infection, it's really one of the worst kind of lung infection we've ever seen scientifically. So this is not a variant to take lightly. We've got our work cut out for ourselves. So I hope that gives a perspective to our listeners as to why the scientific and the medical community, as concerned as they are, and why that is.
Obviously, the breakthrough cases are the ones that have most of the vaccinated people really concerned. I read some interesting stuff about that today, and I found it encouraging. And one of them was simply that the breakthrough people had such a small, let me see if I have some of the information right here. Here it goes. Yeah, because they suggest that there was only a half of 1% chance of getting long COVID if fully vaccinated, and almost a 0% chance of dying, at least in this one study that they did that was reported in the New England Journal of Medicine. Furthermore, none of the cases were hospitalized or died, and again, a 0% chance of those two outcomes if fully vaccinated. It's interesting, though, the breakthrough cases could be part of the problem with testing, right? Some of the testing might see the actual virus in your blood, but not having yet invaded a cell. How does that work? Is it like if I inhale the Delta variant and it gets into my bloodstream and I'm double vaccinated, is it possible it could break into some cells, but not just enough to make me sick? Is that the idea?
Sort of. So when we are vaccinated, for those who are vaccinated with the double vaccines, they have immunity. So vaccine, the way it works is that we have memory cells. It's like creating a backup of soldiers, so to speak, within our immune system that are ready to fight if we are invaded with this the next time. So with that analogy, what you're saying is it is what it is, basically, because whenever we're vaccinated, we have those fighters ready for us with memory cells. And so next time when we're getting a variant, even if it is a different variant, we have our body is recognizing those and have the tools to fight it. And so, yes, it is going to have a little bit of effect because it is going to have an immune response. So we will feel sick from it a little bit. But that major issue that we're seeing with people who are not vaccinated, who are unprepared, who are actually ending up with serious lung infection, ending up on the ventilator, ending up in the ICU, that kind of serious illness is not really expected in people who are vaccinated just because they have that additional protection in the memory cells and the body is ready to fight.
I spoke to a science writer, a friend of mine named Faye Flam, who works for Bloomberg, and we were talking about, just the idea of this the double vaccinated and this and would we need boosters? And right now it doesn't seem like that. Even with the report today that Pfizer after 6 months may go down to 84% protection. But are you of the belief that we won't need boosters anytime soon?
I would like to see more data on that before I can make a comment on it. But I will say, judging by the amount of variants we're seeing that are coming up in such a short period of time, I'm going to choose flu vaccine as an example. That is also a virus that all viruses, they tend to mutate, and something that lingers, it will mutate because it goes from host to host. Typically, they do require boosters. We do better with boosters because with boosters, as our immune system wanes over time, it gives us a fresh set, and so usually it helps. I am of the belief, I think we are going to benefit from a booster, like a third shot. I do agree with that, judging by how it's going. But before it can be implemented, I do believe that we need a little bit more data, more robust data to say that, yes, this is beneficial.
Wow. We're speaking with Dr. Fahmi Farah, MD and cardiologist, about this variant, this Delta variant. Obviously watching what's happened in the last year and a half since the introduction of this, a lot of this was predictable, right? That we knew that there'd be mutations. What has surprised you the most over the first, year and then in the last 6 months?
So usually, as you said, with any virus, especially if a virus lingers on for this long, mutation is an expectation because that's just how virus thrives. They go from host to host, and the longer they survive, the more variants we're going to see. So yes, it was an expectation that we were going to see different variants. What's surprising to me is typically, historically, other viruses that we've seen, usually as they mutate, they they get downgraded, so to speak. They become less vicious. They become less contagious. So they kind of lose their virulent property to some degree. This virus is a little bit different, in my opinion, because that's not what we're seeing. With each variant, it's kind of like it's getting worse. So it's getting smarter. The virus is getting smarter. It's figuring out how to be more contagious, be more infectious, be, like the infection itself is becoming more severe. So that part is a little bit surprising for me, especially when a virus is lingering on for this long, that we're not seeing it becoming less virulent. We're seeing the opposite effect.
Interesting in that, you look at something like smallpox, which has like a mortality rate somewhere between 30 and 40%. I think that's accurate, right? And then you look at something like this that is easier to spread, but it doesn't have the same mortality rate. It's still somewhere under 0.5% apparently. I guess we worry about the vaccine that could break, the part of this could break through our vaccine on one end. But do we also worry about the evolution of this possibly becoming more virulent and more of a danger and with a higher mortality rate? Does that ever happen?
Typically, historically, not really. I mean, it can, but historically speaking, like usually as they mutate, they become less. But in this one, we are seeing somewhat of a different nature of the virus, which is, even though it's been so long and it has gone through so many different variants right now, the Delta kind of proves that it's still going upwards in terms of how dangerous it can be. It's becoming more virulent, so to speak. That part is it is somewhat of a surprise for me, because one of my expectations was that as it mutates, it's going to get less virulent, but that's not kind of what we're seeing with this one.
And is that the nature of coronaviruses? Is that they because from a pangolin to a bat or however. It's unpredictable because it happens in the wild and then we're infected. Is that the nature of a zoonotic? Is that what it is? Zoonotic leap? Does that make sense? That question?
Can you repeat that one more time?
Yeah. Okay. I kind of butchered that. I guess. So are most coronaviruses as unpredictable as the SARS-CoV-2?
Yes, coronaviruses, they typically are the more difficult virus to deal with. Usually we've seen it in the past. That part, it's not entirely a surprise. But even among historically the ones we've seen, this was obviously the worst one so far.
I've read just as much as I can find about the origins of this and throwing the politics and the speculation aside. Everybody I hear talk about this says that there's nothing about this that indicates that this was man-made, that it occurred in nature, whether it occurred in as an accident. But Fauci has stood up to Rand Paul and others and said there was no apparent gain of function research that created this particular virus. Its origins seem to indicate that it kind of came organically. Have you read much about that?
Yeah, I have actually. That's something that I was very curious about, and I think a lot of people are curious about, like, the actual origin. How did it come from another species, and how did it come? So there's quite a bit of debate over that, and I'm pretty sure you've read some of those chronicles and articles. Initially, there was the thought that it jumped from another species, right? I wouldn't really know how to comment on that, just because we simply don't have enough proof. And I know there's an ongoing investigation going on with China. I know that President Biden had wanted more investigation to figure out what the actual origin was. I don't think we quite have an idea as to what the real origin was. Did it really jump, from another species to humans? And if so, how come it came so quickly? Typically, when it jumps a species like that, historically speaking, it does go through quite a few steps. It's usually not just like jumping from one species to another and being so quick spread. And so that part I do have questions about. I do have quite a bit of curiosity. I think many of us do in the medical community and otherwise. And I do feel that that warrants a significant amount of investigation to really get to the bottom of how did it come, what is the actual origin.
Well, China won't participate, nor would the United States, I would imagine, if there's something came out of Fort Detrick. But which is a biodivision weapons lab in Maryland. I know that, obviously the idea that, back in 2018, they invited us to the Wuhan Virology Institute, and we sent people there, and they sent a cable back saying that they saw, they were studying transmissibility between bats and humans, and they were worried about their protocols, and we ignored it, So, I mean, to me, obviously we got to reach out, right? When you agree, we have to reach out to the rest of the world and try to work together on this because, we need a heads up. Everybody does.
Oh, absolutely. I completely agree with that. I mean, this is absolutely a global problem. This is not something we can tackle on our own. And I do think that the world together needs to come together as a team to figure out what the problem was. I think it's absolutely essential for us to get to the core, the bottom of where the origin was, so that we can prepare ourselves and we can have a protocol in place so that we don't let this happen again, in the future, so that the world doesn't suffer. It's really not one country's problem. It's the whole globe. It's a global issue.
Thank you. I really appreciate your time. Again, from Baylor Scott and White, is that a hospital or is that a research facility? What is that?
Baylor Scott & White is a hospital, yes, and my clinic is Bentley Hart Cardiovascular Institute.
Dr. Fahmi Farah, thank you so much. I hope you come back again with us, and I appreciate your time. I know it's very valuable.
Thank you. It was a pleasure. Thank you for having me.
Take care.